Hi all, Dr. Shesnia here, consultant radiologist at Plasma Medinostics. Today our topic is PCOD, Polycystic Ovarian Disorder. We have all heard about it, but what is PCOD? Do we know in detail? Let us learn today. PCOD is a hormonal disorder which involves the enlargement of the ovaries wherein there are multiple small cysts that leads to ovulation issues. What are some of the symptoms of PCOD? Irregular periods or amenorrhea, weight gain, hirsutism or excessive hair growth on the face and body, acne, male pattern baldness, etc. And in severe forms of PCOD, which is PCOS, we also see metabolic symptoms like insulin resistance, increased cholesterol, increased BP, depression, anxiety, sleep apnea, etc. So, what leads to PCOD? As I mentioned, hormonal imbalance. Increased levels of androgen hormones in the body is the main cause of PCOD. Also, there is a genetic link to it. That means it runs in the families. Also, because of your lifestyle, sedentary lifestyle and physical inactivity, obesity can also be a factor contributing towards PCOD. Then exposure to environmental toxins, that is EDC, endocrine disrupting chemicals, also play a role in contributing to PCOD. Then we have certain medical conditions like thyroid disorders, congenital adrenal hyperplasia, Cushing syndrome that also lead to PCOD. Then patients with insulin resistance that have high blood sugar levels also play a role in providing hormonal imbalance. So how do we detect PCOD in a patient? First of all, medical history is very important. Irregular menstrual cycles and also physical examination to see if there is acne or hirsutism and weight gain history. Another thing is hormonal level test to detect increased levels of androgen, that is testosterone hormones in the body. Then glucose tolerance test to detect insulin resistance and diabetes, and lipid profile test to detect increased levels of cholesterol and triglycerides. And the most important, ultrasound. In this, we study the size and shape of the ovaries. If it is more than 10 ml, it's an enlarged ovary. We also count the follicles in the periphery of the ovary. If it is more than 15 to 20 follicles, it is considered as PCOD. Also, we see if there's increased ovarian stroma, and also we look for the vascularity in the ovaries. Now, we follow the Rotterdam's criteria to diagnose PCOD. Any two of the three things are essential to diagnose it as PCOD. First one, irregular menstrual cycles. Second one, hyperandrogenism or increased androgen hormones in the body. And third one, polycystic ovaries. Now, what is the treatment of polycystic ovarian disorder? First of all, we can give symptomatic treatment. Birth control pills to regulate the hormones. Fertility medications to stimulate ovulation. Anti-androgen medications for acne and hirsutism. In case of diabetes, anti-diabetic medication. And we need to modify our lifestyle. That is, dietary changes, exercise, weight management, etc. helps us to reverse PCOD. Moving on to the most important part of my talk. How to reduce the risk of developing PCOD. First of all, maintain a healthy weight. Manage stress. Eat a balanced diet, stay hydrated, exercise regularly, get enough sleep, consider dietary supplements, avoid smoking and alcohol intake, limit processed foods and added sugars, and last but not the least, regular checkups. Thank you. Have a nice day.